Eye diseases or conditions can cause visual impairment. Some of the more common causes of low vision include macular degeneration. Macular degeneration is a disorder that affects the retina, the light-sensitive lining at the back of the eye where images are focused. The macula, the area on the retina responsible for sharp central vision, deteriorates, causing blurred vision. This can cause difficulty reading and, for some, a blurry or blind spot in the central area of vision. The most common form of age-related macular degeneration is known as non-exudative, or the dry form, in which vision loss usually progresses slowly. More rapid and severe vision loss comes from exudative, or the wet form, of macular degeneration. In the wet form, abnormal blood vessels develop under the macula and leak fluid and blood. Both exudative and non-exudative forms of macular degeneration are age-related. They are the leading cause of blindness in people over 50. Recent studies estimate that over 1.6 million older Americans have age-related macular degeneration. The exact cause is unknown. Although age is the primary contributing factor, cigarette smoking and nutrition can also play a role in the development of age-related macular degeneration. A hereditary juvenile form of macular degeneration called Stargardt macular dystrophy can also cause vision loss. Cataracts. A cataract is a clouding of part or all the lens inside the eye. This clouding interferes with light reaching the retina at the back of the eye, resulting in general loss of vision. Causes include aging, long-term exposure to the sun's ultraviolet radiation, injury, disease and inherited disorders. If the eye is healthy, a cataract can be surgically removed. Usually, an intraocular lens implant is inserted in the eye, and vision is restored. Cataract surgery has a high success rate in otherwise healthy eyes. However, cataract surgery is not always possible for people who also have other eye diseases. These people may require low vision rehabilitation to maximize their remaining vision. Glaucoma. Glaucoma causes damage to the optic nerve. Most commonly, this occurs due to increasing internal pressure in the eye because of problems with the flow or drainage of fluid within the eye. It can also occur when the internal pressure of the eye does not increase, normal tension glaucoma, but there is not enough blood flow to the optic nerve. There are no early symptoms in the most common form of glaucoma, but the first signs of damage are defects in side, peripheral vision and difficulty with night vision. If diagnosed early, it can be treated with drugs, or sometimes surgery can minimize vision loss. Diabetic retinopathy. People with diabetes can experience day-to-day changes in their vision and/or visual functioning because of the disease. Diabetes can cause blood vessels that nourish the retina to develop tiny, abnormal branches that leak. This can interfere with vision and, over time, may severely damage the retina. Laser procedures and surgical treatments can reduce its progression, but regulating blood sugar is the most important step in treating diabetic retinopathy. Retinitis pigmentosa. Retinitis pigmentosa gradually destroys night vision, severely reduces side vision and may result in total vision impairment. An inherited disease, its first symptom night blindness usually occurs in childhood or adolescence. Amblyopia. In amblyopia, the visual system fails to develop normally during childhood. The blurry vision that results in one or both eyes is not easily corrected with normal glasses or contact lenses alone. Retinopathy of prematurity (ROP). Retinopathy of prematurity occurs in infants born prematurely. It is caused by the high oxygen levels in incubators during the critical neonatal period. Retinal detachment. With a retinal detachment, the retina separates from its underlying layer. It can cause total vision impairment in the affected eye. Causes include holes in the retina, eye trauma, infection, blood vessel disturbance or a tumor. If diagnosed early, most detached retinas can be surgically reattached with vision partially or completely restored. Acquired traumatic brain injury. Vision can also be lost or damaged as a result of head injuries, brain damage and stroke. Signs and symptoms can include reduced visual acuity or visual field, contrast sensitivity, blurred vision, eye misalignment, poor judgment of depth, glare sensitivity, confusion when performing visual tasks, difficulty reading, double vision, headaches, dizziness, abnormal body posture and balance problems. Treatment 1. Get enough key vitamins and minerals. Vitamins A, C, and E, as well as the mineral zinc, contain antioxidants that can help prevent macular degeneration. It's a condition in which the macula, the part of the eye that controls central vision, deteriorates. Food sources for these important nutrients include a variety of colorful vegetables and fruits, such as carrots, red peppers, broccoli, spinach, strawberries, sweet potatoes. Citrus foods rich in omega-3 fatty acids, such as salmon and flaxseed, are also recommended for better eye health. 2. Don't forget the carotenoids. A few other nutrients are also keys to improving eyesight. Among them are lutein and zeaxanthin, which are carotenoids found in the retina. You can also find them in leafy green vegetables, broccoli, zucchini, and eggs. Lutein and zeaxanthin can also be taken in supplement form. These carotenoids help protect the macula by improving pigment density in the part of the eye and absorbing ultraviolet and blue light. 3. Stay fit. Yes, exercise and maintaining a healthy weight can help your eyes, not just your waistline. Type 2 diabetes, which is more common in people who are overweight or obese, can cause damage to the tiny blood vessels in the eyes. This condition is called diabetic retinopathy. Too much sugar circulating in your bloodstream injures the delicate walls of your arteries. Diabetic retinopathy causes the very small arteries in your retina, the light-sensitive back part of the eye, to leak blood and fluid into the eye, harming your vision. Getting your blood sugar levels checked regularly and staying fit and trim can lower your odds of developing type 2 diabetes and its many complications. 4. Manage chronic conditions. Diabetes isn't the only disease that can affect your vision. Other conditions, such as high blood pressure and multiple sclerosis, can affect your eyesight. These conditions are linked to chronic inflammation, which can harm your health from head to toe. Inflammation of the optic nerve, for example, can cause pain and even complete vision loss. While a disease such as multiple sclerosis can't be prevented, you can try to manage it with healthy habits and medications. High blood pressure can be effectively treated with a heart-healthy diet, exercise and antihypertensive medications. 5. Wear protective eyewear. Whether you're playing racquetball, working in your garage, or doing a science experiment in school, it's vital that you protect your eyes with appropriate eyewear. Tough, protective eyewear is essential if there is a risk of chemicals, sharp objects, or materials such as wood shavings, metal shards, or even a stray elbow during a basketball game entering your eye. Many protective goggles are made with a type of polycarbonate, which is about 10 times tougher than other forms of plastic. Shop for protective goggles. 6. That includes sunglasses. Sunglasses aren't just for looking cool. Wearing shades is one of the most important steps you can take when it comes to improving your eyesight. You want sunglasses that block out 99 to 100% of UVA and UVB radiation from sunlight. Sunglasses help protect your eyes from conditions that stem from eye damage. These include cataracts, macular degeneration, and pterygium, a growth of tissue over the white part of the eye. Pterygiums can lead to astigmatism, trusted source, which can cause blurred vision.